Hi, my name is Jennifer Sheridan Palute. I'm the Director of Policy for the Parkinson's Action Network. And I just got married, so my new last name didn't get on my name card, but it's cool. I answered all of it. So thank you for having me here to talk about a piece of legislation that I've actually been working on for years. And so excited to talk a little bit about some of the progress that's being made already in the 114th Congress. A little bit about my organization. We are a nonprofit educational and advocacy organization that represents people living with Parkinson's disease. Parkinson's is a chronic progressive neurological condition. We do have symptomatic treatments, but nothing that slows or stops the progression of the disease. So there's a lot of work going on to better understand the disease and hopefully develop disease-modifying treatments and maybe one day a cure. But we do the public policy on behalf of the Parkinson's community. There are several other national Parkinson's organizations that fund research, provide services, and do other educational services within the community, but we are the only ones who are here in Washington talking to Congress and the administration about Parkinson's and the research and services that we need. So, as background about this piece of legislation, one of the things that's been missing for, I think, a lot of neurological conditions, but from a Parkinson's perspective, has been not really having a clear understanding of the incidence and prevalence of the disease. So for Parkinson's and our main partner, the Multiple Sclerosis Society, we've really been kind of battling, how do we get more data on the diseases that impact Americans? So for Parkinson's, a lot of the organizations that I represent have kind of estimated that there's about 1 million people living with Parkinson's. And to be honest, that is a back of the envelope estimate. And I know that there are many neurological conditions that fall in the same boat. My organization a couple of years ago, based on some of the studies that had come out, have actually kind of taken this broad approach of saying 500,000 to 1.5 million Americans because the data is all over the place. And so one of the ways that we've approached this piece of legislation is to just have a better understanding of the number of Americans that are living with the disease. For the multiple sclerosis community, they've said about 400,000 people are living with the disease, but actually a couple of years ago, there was such strife within the scientific community that they actually took that number off their website because it was based on a study that was done in the 1970s that had basically just been extrapolated over the years. And they really felt like it was not accurate. So they are not using a number at all, which is kind of interesting for a disease that's pretty well known. So what we want to learn is not only just the incidence and prevalence numbers of our diseases, but to have a richness of data that's available so we actually can understand risk factors for disease. Are there hot spots? Are there regional differences that you can actually see based on information that's available? So, for instance, for Parkinson's disease, we know that there are environmental risk factors. If you are an agricultural worker in certain counties of California, you have a higher risk of Parkinson's. But we don't have that information for the entire country. Are there other areas within the United States, like the agricultural belt, or the South, or the North, where we can actually better understand what those populations look like? And scientists and epidemiologists can then say, what else should we be looking at? Is this because of the pesticides and herbicides that people are using in their occupational hazards? Is it well water? Is it something else? So it's kind of can bring up additional scientific questions that can be answered. So a piece of legislation that's been introduced this Congress is H.R. 292, which is the Advancing Research for Neurological Diseases Act of 2015. Also a mouthful, but we don't have a fun acronym yet. If you have one, let us know. It was introduced in January by Representative Michael Burgess. He's a Republican from Texas and a senior member of the Energy and Commerce Committee and on the Health Subcommittee. And Representative Chris Van Hollen, he's a Democrat from Maryland who's also the ranking member of the Budget Committee. These two members have been longtime supporters of this effort and of Parkinson's and multiple sclerosis activities on the Hill, and so we're happy to have them support the bill this year again. The bill has been referred to the Energy and Commerce Committee for consideration. So a little bit into the legislative highlights. It requires the Centers for Disease Control, the CDC, to establish a data collection system on incidence and prevalence on neurological conditions. It really will leverage existing data sources. So think of one central place where we can pull together information from Medicare, Medicaid, the VA, some private registries, like I mentioned, we have some data from California, state registries, some private insurance information, with really the hope that we would have data that can be analyzed that would be focused on the epidemiology, the natural history of the disease, prevention of disease, and detection and management and treatment service opportunities. It does have provisions to protect patient safety, patient privacy of data. The CDC has to, when they're establishing the infrastructure, would consult with experts, including epidemiologists, representatives of patient organizations, health information technology experts, clinicians, and research scientists with expertise in data collection systems. It also requires a report to Congress after 4 years, really focused on giving them information on what data has been collected and how that data has been used by researchers. And it also requires coordination with other federal agencies, including the National Institutes of Health, the VA, and others. And really, in terms of when you're looking at the cost of neurological conditions to society, this is a very affordable proposal. It would authorize $5 million a year over 5 years. So really a drop in the bucket compared to the treatment of neurological conditions in the United States. As I said, I've been working on this bill for forever. It feels like forever. It has been introduced in several Congresses. It had a different name. It was the National Neurological Diseases Surveillance System Act. Really crappy name. Surveillance system is the public health term for the system that would be set up at CDC. Sometimes people are a little freaked out, particularly after Mr. Snowden, about surveillance, and so we wanted to give it a different title. We actually really had some success in the 111th Congress. It was passed through the Energy and Commerce Committee and passed unanimously by the House of Representatives. That was in 2010. When the bill went through the House, we had over 200 co-sponsors, and what's interesting is when you look at kind of who's still in Congress, more than 100 of them are still available, are still here in Congress, and so nice pot of people to go after in terms of co-sponsors, since we have a lot of previous co-sponsors who are still in play. Unfortunately, we ran out of time in the 111th Congress, and we couldn't secure Senate passage in time before the session's over and you have to restart. So in the 111th Congress, the bill was introduced, but we heard pretty quickly from the committees that they weren't interested in moving this type of public health bill. It was right after the Affordable Care Act, and kind of all the oxygen was out of the room related to a lot of health-related legislation. The bill was not reintroduced in the 113th Congress. We really wanted to take a step back and have some conversations within our communities about, is this the right approach? Are there other ways to collect the data, like private organizations starting to collect the data? And where we really ended up was organizations within the Parkinson's community or the MS community could probably fund small pieces of the puzzle, but that really the CDC and the federal government, because they own a lot of the data that would be used, really needs to be a key player, and they have the ability to really pull people into the system and have it be a long-term project. So as of right now, that's actually wrong as of today. We actually have 30 bipartisan co-sponsors on HR 292, pretty bipartisan at the moment, and a good mix of previous co-sponsors as well as new members who are getting on board. We are working on Senate introduction of the bill. So as Eric mentioned, if you want to talk to your senators about the importance of this concept and if they're interested in supporting or leading, we would love to hear it. And we were very excited that the piece of legislation was also included in the discussion draft of the 21st Century Cures Initiative. One of the things that we're trying to do is show as much bipartisan support so that it stays in the 21st Century Cures Initiative. So as you talk to your members, we'd love to make sure that it's included as it moves forward.
Excellent.
Wow.
Oh, are you? Go ahead.
One last thing is just thank you so much for your advocacy. We really appreciate it. I know my advocates are going to be on the Hill in about a month, and so it's nice to have you all asking your members to support the bill, and hopefully we'll make some great progress. And as I said, as much bipartisan support as we can get is going to be really important as the 21st Century Cures process continues. So thank you so much.